I'm Dr. Julia Turner, and I'm going to tell you what you can do to protect yourself from getting coronavirus. So remember how coronavirus is spread through respiratory droplets. After someone coughs, sneezes, or speaks, they can go through the air and go into your eyes, nose, or mouth, or they can land on surfaces, and then anything you touch, you can put them in your face. So the best thing to do is to stay away from all people, especially anyone with a cough or a fever or who's sneezing. Stay at least 1 to 1.5 meters away from everyone else. Wash your hands regularly. Every time you touch something, then you must wash your hands afterwards. Preferably before and after you touch anything, you wash your hands. Definitely don't touch something like your cell phone or a shopping trolley and then touch your face afterwards. You must wash your hands before you then touch your face. Clean all the surfaces that you have to touch. So if you've gone out somewhere, come back, clean your cell phone, clean your handbag. You can use a bleach solution to do this. And don't share utensils that someone else might have eaten with or drank with. So the best way to wash your hands is with good old water and soap, and to wash your hands thoroughly for 20 seconds. If you don't have water and soap, you can use a hand sanitizer, but it must be above 70% alcohol, or you can use a bleach and water mixture. So in South Africa, we have about 7.7 million people with HIV. About 5 million of them are on ARVs, and about 2.7 million are not. Those who are on ARVs, most of them have a suppressed viral load and a good CD4 count, which means that their immune system is strong and can fight diseases. Some people, however, have not been taking their ARVs correctly and may have a high viral load and a low CD4 count, which means that their immune system is weak and cannot fight infections. The people who aren't on ARVs might not know that they have HIV, or they might have stopped taking their ARVs. So the people who have a suppressed viral load and a good CD4 count most likely don't have any increased risk of getting severe coronavirus. However, we don't actually know this because we haven't seen coronavirus in this population yet, but we don't anticipate that these people will be more sick than people without HIV because they are taking their treatment well. But these other people may be at risk of severe coronavirus. So we ask that anyone who doesn't yet know their HIV status and might be at risk to please come and test for HIV so that you can start ARVs. If you've previously stopped taking your treatment, please restart immediately. And if you have a high viral load and a low CD4 count, please come to clinic so that we can get you onto the right ARVs for you and get your viral load suppressed. We want to get you rather in the group of people who will not be at high risk of severe coronavirus. We also encourage everyone with HIV to get a flu vaccine. This is to prevent you from getting flu so that it can't damage your lungs, as you don't want to have flu as well as coronavirus. So TB in South Africa is also very high burden. We get about 250,000 people every year with TB, and there's a higher chance if you have HIV and a low CD4 count. So if you have a TB contact or a cough or fever or night sweats or loss of appetite or loss of weight, please come to the clinic and be tested for TB so we can get you on treatment quickly. We don't want people to have TB and not be treated and then get coronavirus as well, as both of these conditions affecting the lungs will likely result in very severe disease. And if you're HIV positive and you haven't had TB prevention therapy, please come to the clinic to start TPT so we can prevent you from getting TB. In South Africa, we also have many people with other chronic illnesses. If you have high blood pressure or diabetes, please make sure that your sugar and your blood pressure are stabilized. Please take your medicine for your chronic illness. Please take all precautions to prevent yourself from coming into contact with coronavirus. So what is social distancing? It basically means staying away from all people. If you have to make contact with people, then you must stand at least 1.5 meters away from anyone else so that if they cough or sneeze, the respiratory droplets will not reach you. So no social gatherings should take place at all. Public transport should be avoided. Pubs, bars and restaurants should close. Sports events and gyms must close. Schools and universities should close, and workplaces, where possible, people can work from home. Churches, synagogues and mosques must close. So if we don't use social distancing, one person would infect 2.5 people in 5 days and 406 people in 30 days. Whereas if we practice social distancing and we have 50% less exposure, then one person will only infect 1.25 people in 5 days and 15 people in 30 days. If we increase the social distancing and have 75% less exposure, we would only have 2.5 people infected in 30 days. So you can see here the dramatic improvement in the numbers of people who would be infected if we practice social distancing. You might have heard us talk about wanting to flatten the curve. Well, this is what we mean. So in the red graph, you can see the number of cases increasing daily very quickly. This is when you don't practice social distancing. But if you do put in social distancing measures, then the spread will be much slower, and even if the same number of people become infected, it'll happen much slower, one at a time, and this will then flatten the curve so that the health system can actually cope with the load. So instead of all 10,000 people needing hospital beds at the same time, they rather can be staggered, and maybe 10 people a day need a hospital bed. This means that our health system can actually cope with the people who are sick and help them survive so they don't die, even though people are still becoming infected. So we didn't make up these graphs. You can see it in real life from an example in 1918 when a flu virus hit 2 cities in America, Philadelphia and St. Louis. In Philadelphia, the authorities didn't think it was too serious and let everyone continue with their public gatherings. You can see how the number of people who were infected and died increased dramatically over a very short space of time, leaving a lot of people dead. Whereas in St. Louis, they put in very strict social distancing measures, so people did not infect each other very quickly. So only one by one people got sick and infected, but the health system was able to look after these people, so the death rate was much, much lower. This is what we mean by flattening the curve. So unfortunately, initially, South Africans didn't take the social distancing guidelines seriously enough, and our graph was increasing rapidly with new cases. But after the lockdown, you can actually see the effect that it's had, in that it has eventually flattened our curve. So you can see that Hong Kong, Singapore and Japan, they did very, very well in flattening their curve, but we have done quite well with South Africa during the lockdown period as well. You'll be glad to know that many international organizations, research institutions and pharmaceutical companies are trying very hard to develop vaccines and treatment for COVID-19. Many clinical trials have already started, and some will be starting in South Africa shortly. We are very hopeful that we will develop a vaccine or treatment. However, we cannot bank on this, as sometimes vaccines and treatment can be difficult to produce. You can be reassured that our government, our National Institute of Communicable Diseases, the NICD, and our Department of Health is taking decisive action against this virus, and our healthcare workers on the front line are working tirelessly, as well as many other NGOs and organizations such as mine. I now call on you, the people of South Africa. We need each and every one of you to pull your weight in order to fight this disease. Please practice social distancing. Look after your own health. Have the tests that I've suggested and take your chronic medication. Protect the elderly and people with other illnesses. Do not transmit this illness. Take all preventative measures to decrease transmission by washing your hands and surfaces and staying away from other people as much as possible. If you develop a fever or a cough, please stay at home. Don't panic. Call the national hotline number, which is toll-free, and they will advise you whether you need to go to the clinic or hospital for testing or not. Please do not flood the clinics and hospitals, as the services need to be kept available for those who are really ill and need critical care. If you become short of breath or are having any trouble breathing, please come to your nearest hospital immediately. Please support one another, be positive, kind, and caring. Share accurate information from reliable health organizations, such as Department of Health, WHO, CDC, and USAID, and the government. Please do not share fake news, which will just cause panic. Together we can do this, but only if everyone pulls their weight. Please take note of the South African National toll-free hotline number 0800 029 999 and other useful platforms from our Department of Health, NICD, and WHO offering accurate, up-to-date information on the coronavirus pandemic. Thank you very much and good luck. Thank you for watching this video. Please look out for others like this. The numbers that you can call.